So I've learned that responding to treatment isn't an instant thing. So it's not like you take a paracetamol for a headache and you feel better within a few minutes, really. Response to GvHD treatment is slow, painfully slow sometimes. And what I tried to focus on was noticing the gradual changes that happened. So for me, I really suffered badly with my skin GvHD, and it was really obvious that I had it. You know, there was no denying that there was a big rash and it was really red. And so when I started my treatment for that, it was quite slow in seeing that that changed. My mouth, GvHD, for example, was difficult to cope with. And when I started treatment for that, it took a long time to see and to feel a dramatic change. And getting your head around that is really difficult because you want things to just improve immediately. You have this expectation of taking a tablet and all will be fine. And it's really not like that. And also, response to treatment for GvHD isn't this straight line, straight linear line. It's very, very up and down. And it's about getting used to those up and downs. And it's about accepting those up and downs and taking those improvements, those small ups, as often as you possibly can. I think from a physician's point of view, it's looking at what the GvHD problem is and finding the right pathway for treatment. And it's almost quite regimented, I imagine, from a physician's point of view. Whereas from a patient's point of view, it's really not just about the physical symptoms that you're suffering with GvHD, but it's the mental and emotional side of it as well. You know, you're living with this every single day. And it quite can be quite debilitating, and it can make you feel like you don't recognize yourself. And almost I found that the GvHD, coping with that is much harder than when I had to cope with the leukemia and the chemotherapy. So I think there's a lot to take on board as a patient. And, you know, you want there to be this instant calm, this instant change, this instant response. And it's really difficult dealing with that alongside the GvHD every single day. So for me, I've had lots of different treatments for my various different GvHD issues, and some of those treatments have worked and have worked like quite instantly in comparison to, you know, it being years and years. It worked within months. I noticed differences. There's been treatment that's worked brilliantly and then stopped, and I've had to go down a different pathway and try something new. And each time with treatment, you can feel a little bit despondent as to what's happening in the day to day and seeing these changes. So for me, I took photographs of my skin GvHD so that I could track and see these changes that happen, because they do happen. It's just that sometimes it's difficult to see them day to day. I took the improvements from my mouth GvHD, and I wrote notes about what happened that like those days and when things were better and when things were worse and what maybe triggered it to be better or worse. And you kind of find a way of managing it yourself alongside the treatment, managing it too. But it just takes a lot of time. And the physicians are really involved in, you know, asking you how things are going and asking what your symptoms are like. So keeping a record of those and not only helps you to see those changes happening and feel some progress yourself, but it also helps obviously with being able to feed back to them. For me, I really try and take those small improvements, those little tiny things that may have happened, the adjustments that have happened to being able to eat different foods now or feel a little bit brighter. You know, taking treatment affects the whole you, not just your GvHD. And it's about seeing the bigger picture of that, you know, being able to get up and do as much of your day as you can in any way that you do it makes you feel better. And it's those sides of responding to treatment that's not just about your GvHD calming down. It's about how you feel in yourself and the improvements that you make emotionally as well as, physically and mentally. But it's hard. Living with GvHD is really difficult. I'm by no means at the end of my GvHD journey, and the different treatments that are the roads that I'll be going down. And it's difficult, and it's difficult to see the bigger picture. But the bigger picture is there. It just takes a long time. So keep in mind that it's not going to be a quick fix, but fixes will come. It will happen.